Welcome back to the Medical Alley Association series Leadership Through a Crisis. Joining us today is President of Bind On Demand Health Insurance, Jodi Hubler, to talk about how her startup uniquely grappled with the situation and how they protected their employees and customers throughout the pandemic. Jodi, thank you so much for joining us. Can you talk to me a little bit about when the pandemic personally hit you?
Yeah, I think it hit in waves, in phases, actually. A number of our executives were on a trip out to California and landed at the end of February, the day that San Francisco actually declared a state of emergency. And using those words, I grew up as the daughter of an American Red Cross disaster leader, and those words of state of emergency really conjure up a level of seriousness and gravity. The following week, I was in Boston, and Logan Airport had their first COVID positive patient come through, and I was watching the Boston ecosystem and community really deal with what that was going to mean and how was it impacted. That weekend was the first weekend that we declared work from home for our San Francisco office. And by the following Friday, we had transitioned all 200 plus Bind employees in our offices in San Francisco, Minneapolis, and New York City to work from home. And I think it was in that wave of that 2-week period that we knew we were dealing with something substantially different than what we had any prior historical comparative experience. So it was in waves.
Yeah, that's a very real experience when your boss pulls you aside and says, take everything you need with you to go home. I don't know when you're coming back. When that happened, did your role have to change? Did Bind have to change? Or were you kind of made for something like this?
Yeah, it's funny that you actually even end with that, because I've talked inside the company and externally to our plan sponsor members and our members that Bind was made for such a time as this, as a condition-based benefit, an insurance company that begins with conditions. We're purpose-built for infectious disease. It was already covered at a $0 copay for testing. We did not need legislation. The impact of COVID, the furloughed employees, the number of folks that were impacted financially, the great benefit of being away and unburdened from high deductibles is that you already had financial relief built into the financial product. So from an external perspective, we were able to meet our plan sponsors and to meet our members at some level at the pace of the virus. We were there to talk about what was available for testing, what were the financial implications from a testing perspective, were they covered? We could move with the CARES Act. We could move with legislation in a way that allowed for a level of nimbleness that many of our quote unquote peer group in insurance design and benefits were not ready for. Internally, it turned the role from one that, the pace of a startup is already intense. The movement of the company, we had an opportunity to really lean into what is already uniquely Bind, a level of communication, a level of transparency. We worked in a virtual world, the ability to move in 24 to 48 hours to a 100% virtual. We really leaned into some of the cultural norms in the startup that was based off of a technology platform. I think the interesting part, though, is that it also meant that role leaned into my past as a leader in a manufacturing environment. And you wouldn't think about business continuity planning for manufacturing. What do you deal with safety, environmental, and health? What do you deal with plant coverage that needs to work 24/7, 365 inside of a health plan? But as a leader, those were past experiences and skill sets that I could lean into that really treated this with our colleagues who already had business continuity planning plans in place, that we could bring those out and implement the plan. We had a level of readiness internally and a level of leverage that existed inherently in Bind at a cultural level, at a foundational level, that really was an advantage for us in not only those early days of the pace and the responsiveness, but has allowed us a longevity, a stick-to-itiveness that has been uniquely Bind.
You mentioned moving at the pace of the virus. Is that a conscientious decision or an observation that you've had?
Yeah, it became kind of a quick statement that was one of those pieces of an early quip, an early statement that we as a task force needed to move at the pace of the virus. That meant that we were meeting in the beginning stages. We were meeting daily. We were meeting even into the evenings, over the weekends, really responding as needed based on the virus. It also became a bit of a rally cry. It was a opportunity to really create a sense of purpose, a sense of a unifying opportunity. It also gave a sense of unanimity that the company could really rally around. That we were built for such a time as this, that this is an opportunity for us to really come alongside our members. So that gave us an opportunity to really, whether it was kind of buckle in and respond, or double down and lean into, that pace of the virus meant leaning not only on internally, our gratitude, our the way that we interacted and welcomed people in a virtual world, embracing our humanness, extending ways that we could do a spirit week through Zoom. How could we remain culturally significant and really come alongside our employees so that they could in fact then service our plan sponsors and our members? That meant that we had the opportunity to really meet people where they were, both at a member experience and at a plan sponsor experience.
You talk about meeting daily, nightly, weekends, and the pressure of keeping up pace with the virus. How do you personally, Jodi, deal with that as a leader?
Yeah, I think there were a number of observations that, in the time, I'll say this, and I've said it for a while. In times of crisis, character is as much exposed and then later developed. There were elements of your core desire as a leader to, immediately serve, to take care of your employees, to increase communication, to lead with a level of empathy and acknowledgement, to identify that we were dealing with an unknown. It's one of the biggest challenges of COVID, is that for the first time in history, everybody is being experienced. This was a great equalizer. Everybody was working from home. Everybody was sheltering in place. This wasn't a prior experience of an earthquake, a business disruption, or tornado. We'd had prior experiences of leading during 9/11, of leading during 2008 and the Great Recession. While those were touchstones of prior leading through crisis, this is unique in that the unknowns became, at some level, if you wanted to, almost insurmountable and overwhelming. But you can't allow that to as a leader. You then break that down. You focus on the next thing. You over communicate. You lean in on very clearly lifting up those employees that you were purpose built for such a time as this, who have that kind of expertise and experience themselves, that were desiring in a health insurance company. There's an element of that is about the greater good, that it knows that you're serving a greater purpose, and the ability to really rally around that here we are with 65,000 members strong in the midst of a novel virus and an infectious disease. This is our time. This is our moment. This is our call for action. At the same time, it also meant, again, I'll acknowledge that we need to acknowledge our humanness, the ability to also speak openly about your own experience, speak openly about your own concerns, to acknowledge with integrity and authenticity where you are in your own journey from leadership, those moments when you are tired, when you are fearful, but leaning into those is important. We also made some very concerted efforts to come alongside our employees. We were, at least as we know of it, benchmarked with our human capital team, one of the first to declare COVID mental health days. We added 5 COVID mental health days that allowed for our employees to just name it and call it out, that what we were experiencing at a pace, what we were experiencing at a shelter in place, our employees who were parents, teachers, caregivers who were running Zoom meetings with their infants on their laps, and we were getting to see people in their homes in ways that were wonderfully authentic and also wonderfully vulnerable. We needed to create and name space for them to take a break and to encourage it, to ask leaders to ask when employees were going to be taking their COVID mental health days. That gave a sense of freedom and a sense of, again, authenticity and empathy for people to be able to lean in both on the pressure to respond, but also to be able to understand that they needed that regeneration, they needed to self-care, they needed to take a step back. And that meant we also needed to lead from that space as well.
That's incredible and so important. When you can no longer leave the office, people struggle with ending their work days. Your leadership team encouraging their employees to use those days is wonderful. I applaud you for that initiative. You're a great leader, not only for Bind, but for the Medical Alley Association as well. You sit on our board of directors, and in doing so, you get to have, sort of a 10,000-foot overview of what the entire community has been doing. Talk to me a little bit about your insights into what Medical Alley did and the leadership and collaboration that you saw since COVID-19 hit.
Yeah, I think this was a moment. It was an opportunity for the Medical Alley ecosystem and community to really shine. You were seeing what would have at one point in time been considered kind of never events. That we've talked a lot about convergence. We've talked a lot about cross-industry collaboration, and we saw that at its finest. We saw med device and hospital systems come together in partnerships to ensure proper provisioning for our healthcare systems. The call to action among the board that Medical Alley presented, where there was an opportunity for those who had something to give and those who had a need could come together. We saw manufacturing produce PPE and other equipment that could enable essential workers to have their moments of security and provisioning different than what we saw in other parts of the country. We saw folks that were releasing intellectual property and open sourcing the opportunity for device manufacturers to come alongside in ventilator production. It really was Minnesota and Medical Alley at its finest, and not only in a local, in the sense that, think globally, act locally, but it was absolutely global. We saw industry leaders in manufacturing, health systems, health insurance, medtech, med device, the unique nature that is this ecosystem, step up at every facet of this disease. From that early acknowledgement of the unknown unknowns, from manufacturing and PPE to cross-industry collaboration that ensured not only our readiness, but global readiness. And you've seen that at a pace also that is sustained. You've seen our insurance colleagues rise to the challenge of what are we doing from contract chasing. We're seeing it now that we're opening back up on the return to work and partnership to do what we did for our essential workers, now expand that out in a level of readiness to balance that sense of responsibility to our state and to our population, but also to that economic opportunity and modulating, if you will, the responsiveness to an infectious disease, yet also come together to ensure economic viability and recovery as well. So in my opinion, when I look across the ecosystem broadly, it has just been Medical Alley at its finest. That collaboration and that purpose and cause, providing a unifying event, has been really just amazing to witness.
In that same vein, I really wanted to make sure to ask you, based on your past demonstrated passion for this, has COVID-19 been a catalyst for that healthcare transformation? Or are we in danger of going right back to where we started pre-COVID-19? What are your thoughts?
Yeah, I think there's been an absolute awakening, a shift, right? I think I sympathize with some of the industry writers and authors because I think they've used every analogy, right? From the genie's out of the bottle to the toothpaste can't be put back into the, it's just, we've run out of ways to express that we will never go back. And the exposing of it's not okay. It's not okay that we don't have affordability. It's not okay that we don't have access. It's not okay that we are not taking advantage and leveraging technology, that we are reimbursement burdened. And so the movement, we've had companies that have been at efforts for 10 years that are now finally meeting their moment, but we will not go back. The provisioning in the home has awoken consumers to their ability to demand and expect different. We've experienced a level of efficiency and innovation adoption that has leapfrogged efforts that won't go back. And the economic impact of COVID is still not yet fully known. It will demand in order for the recovery to occur, not only in Minnesota, not only in Medical Alley, but it will require the locking in of the gains we've made and the continued adoption in a way that will ensure the safety of Minnesotans and will absolutely require the financial recovery to demand different, to demand that we lock in the gains that we've made and to demand that we continue the pace of innovation adoption. It's just an imperative. We won't go back.
That was Jodi Hubler, president of Bind On Demand Health Insurance. Thank you so much for listening to this episode of the Medical Alley Association series, Leadership Through a Crisis. To make sure you don't miss a single episode, be sure to visit us at medicalalley.org, sign up for our newsletter, and follow us on all of our social media channels.